I am Dr. Yograj, Neurologist, Apollo Hospitals, Chennai. Migraine headache is a very common kind of headache, and if you consider all the cases of headaches in the world, migraine forms about 70 to 80% of all the headaches. Migraine headache is not a life-threatening disease, but it gives a lot of trouble to one that suffers from migraines. People get headaches often, and it's usually one-sided, and the headaches have a background of triggers, meaning there are environmental factors which precipitate and trigger the headaches. So what is the mechanism? The mechanism is one has a tendency in the system for causing the headaches when the body is exposed to a stimulus, for example, bright sunlight, loud noises, different kinds of food, and lack of sleep, stress, menstruation, etc. Overall, the burden of disease, that is the economic cost of migraine in a society, is very huge. So it becomes imperative that we prevent migraines. The other factor is that every time one suffers a migraine headache, it leaves behind a small damage in the brain. So over a period of time, the cumulative damage may be sufficient to impair a person's brain functioning to a significant level. So how does one treat migraine? There are two ways. One is that you prevent migraine because of the two factors that I just told you. And for prevention, there are two methods. One is avoidance of trigger factors. How do we avoid trigger factors? Now, people who suffer from migraine have to observe their lives very carefully and find out what triggers their migraines. For example, it could be something in the food. For example, eating pizza may trigger your headache. So it's better to avoid pizza in people who get headaches after eating pizza. If you maintain a diary of events for 3 months, the places that you visit and the activities that you've done, and mainly the foods that you've taken, you will get a general idea as to what is triggering your migraines. The other is by taking preventive medicines. There are a host of drugs which prevent migraines, and some of them are very effective. But the point is that how long will you be taking these drugs? So what we usually plan is that we give the drugs for a limited period of time, so that you find out what are your triggers in this given period of time, and then switch from medicines to non-drug or preventive treatment of migraine. One gets migraine in spite of taking drugs. We have abortive drugs which are also very effective, and if taken within a specified period of time, these drugs work very well. What should you not do when you have migraines? I think in my practice, the most commonest thing that I have seen is that people take the so-called over-the-counter painkillers. They take paracetamol, they take ibuprofen, they take naproxen, and they take diclofenac sodium over the counter. And the problem with this over-the-counter painkillers is that they will relieve your headache at that time, but the next time when you get a headache, it's going to be a big one. So this cumulative, snowballing effect of headache will give you more frequent headaches and more intense headaches over a period of time if you abuse painkillers. So the wisest thing to do is not to take painkiller. Get in touch with your doctor and know how to manage your migraine. And there are other methods on a longer time basis to prevent migraine. For example, botulinum toxin injections and feedback therapy, meditation, yoga, etc. So I hope you got a general idea about how to manage your migraine. It's always better to partner with your doctor, which means that you don't let your doctor alone handle your migraine problem. You have to be a participant, take responsibility for your treatment. Then you will probably reap the best benefits of migraine management. Migraine does not mean that migraine is treatable. Migraine means you have to manage it with the help of your doctor. So live a happy life. Thank you.